Hey everyone, this is Discussions with Dr. G, where I, Dr. G, is going to be real from the jump. When people think about health, they usually picture anatomy diagrams or maybe some dramatic ER scene on TV. But honestly, that's only a piece of the puzzle. As nurses working in the community, we see right away that health is shaped by way more than just what's under the skin. It's about your zip code, your paycheck, what grocery stores or hospitals are even within reach. Like sometimes it feels like your address might be as well listed next to your blood type because it matters so much. We see some stark patterns, health disparities as the fancy textbooks call it, especially among people of color, folks living out in the sticks, or anyone scraping by on a low income. I mean, rural Appalachia, chronic illness rates through the roof, way higher than the national averages. When I first started nursing, I remember reading stats and thinking, wow, that can't be right. But then I saw it in real time. Families stuck miles from a clinic, communities where the closest healthy food is a gas station, hot dog. I'll never forget this early patient of mine, a Spanish-speaking mom with diabetes. Navigating the healthcare system was like signing up for a marathon she never trained for, and nobody gave her any shoes. No interpreter, barely any follow-up support, paperwork all in English. I ended up going to bat for her, pestering case managers, getting her a translator, making sure she actually got the resources she needed. And that's when it hit me. Culturally competent care isn't just a buzzword, it's survival for some folks. Nurses, we can't just treat symptoms and send people home. We gotta look at the real barriers, the big picture stuff that's shaping their day-to-day. So let's break it down, what these barriers actually look like. Because it's not just one thing. It's like a whole spaghetti bowl of challenges. Start with healthcare access. Over 27 million people in the US do not have insurance, and a bunch more are technically covered, but can't really afford a single copay without sweating. People in small towns, good luck finding a specialist. Sometimes even a decent primary care doctor is a stretch. You see big consequences, like folks just using the ER for basic stuff because there's literally nowhere else to go, or dental and vision problems snowballing into much bigger health risks. And just so nobody thinks this is an old news whatever kind of problem, look at Flint, Michigan. The water crisis there was a nightmare. Lead in the pipes, entire neighborhoods exposed, and surprise, surprise, the most impacted areas were communities of color and lower income. Unsafe housing, environmental hazards, you name it. It's a stark reminder that where you live can really put your health on the line. Education plays in too. More education generally means better jobs, more stable pay, insurance benefits. But when schools are underfunded, you end up with generational cycles of chronic disease, higher mental health struggles, and more adolescent pregnancies. Nurses can pitch in with school-based screenings, checking vision, hearing, sneaky asthma, and even obesity. And there are programs like nurse-family partnerships that pair nurses with young families, literally starting better health from the crib up. Now, don't even get me started on food deserts. You've got neighborhoods where your best shot at dinner is microwave noodles or a bag of chips. 40-some million people deal with food insecurity. It's huge. So what do? Connect folks to WIC or SNAP, support food banks, advocate for rideshare vouchers so patients can actually get to their vaccine appointments or to a grocery store. Sometimes just making sure someone knows what resources exist is half the battle. Oh, and telehealth. If there's internet access, it's a game changer for rural folks or anyone juggling 3 jobs in no time. Here's the silver lining. Nurses do have power to make things better. It's not about parachuting in with a miracle fix, but about building trust and supporting folks where they are. Number 1 thing, cultural competence. If your care doesn't meet people where they're at, language, values, family, structure, it's almost pointless. Next up, advocacy. Find those local organizations, partner up, and get creative. This could be anything from running vaccine clinics in a library basement to launching health literacy workshops at the rec center. I would love to be able to team up with our local food bank, put together a bunch of preventative health classes. Think grocery store tours, meal prep demos, diabetes and cardiovascular risk screenings. A way to get nursing students involved in the community with real life stuff. How to teach random people about how to read a nutrition label or stretch a food budget. That is community health. And there are some shining success stories out there too. Programs like the Nurse Family Partnership, giving new families a shot at breaking the cycle of poverty and poor health. The Boys and Girls Clubs, huge for mentoring and keeping kids out of risky situations. Nurses can, and do, work with occupational health to make jobs safer or team up with others for big picture policy change. Preventative efforts like pushing vaccines or just making sure info is clear and not medical gobbledygook. This goes a long way. So, wrapping up, I know it sounds big and sometimes a little overwhelming, but every small action matters. Nurses are key advocates, educators, and partners. We can chip away at these barriers, one community at a time. Now, that's all for today. If you're curious about more strategies or just want to nerd out over social determinants, stick around for next time. Take care and keep fighting the good fight.